I know this is a family day weekend, and it takes special dedication to come on this long weekend. It shows a very dedicated group of implantologists, and I don't take that for granted one little bit. You'll be rewarded with a spectacular, groundbreaking seminar that you'll remember for years to come. So here's our schedule of events for today. I will give the introductory speech on implant treatment planning and the use of standardized record-keeping modules to make our life easier. Then at 9 o'clock, we have our dynamite keynote speaker from New Jersey. We'll talk about effective marketing for greater case acceptance. We'll take our first coffee break at 10:30 to 10:45. Then Dr. Gebrael, Professor Gebrael from University of Western Ontario, will speak about anatomical considerations in implant surgery and how to avoid risks. Then we will take our lunch break from 12:15 to 1:15. Then in the afternoon session, we have Dr. Madhavji from Canare, a oral radiologist's perspective on implant treatment planning, followed by our prosthodontic considerations in implant treatment planning by Dr. McDermott. Then we have a mid-afternoon coffee break. Then we'll have a dentist and an attorney, Dr. Matsui, will speak about the legal aspects relating to the provision of dental implant treatment. And lastly, we have a registered dental technician trained in Europe who will speak to us, Slavik Bilko, about a lab's perspective in implant treatment planning. And then we will end it with Dr. Pulak and how to integrate record-keeping modules into existing treatment planning software to make your life even easier. How we can integrate the documents that I've shown you into a modern treatment planning software. So it's definitely an exciting day with a lot of ideas and perspectives, and I think you'll enjoy it a lot. So does anyone read Chinese here? Does anyone read Chinese characters? No one's able to read Chinese? No? Okay. I thought in Toronto we'd have plenty, but today we don't have any. Supposedly this means crisis. This ideogram means crisis. And so we have a crisis in the implant world. There's no doubt. And I'm told that the ideogram for crisis is split into two words. One of them is danger, and the other one is opportunity. Means that whenever there's a crisis, there's a point of danger, of unknown things, but there's also an opportunity for expansion or for something good to materialize. So definitely, with the introduction or adoption of implants, widespread adoption, the dental world is in a state of crisis. It's a new technology that used to be something exotic, boutique for a wealthy few, that now is being rapidly adopted, being incorporated into many different practitioners' armamentarium, and it has introduced a large number of new variables, a lot of unknowns, perhaps a lot of heartbreak, and opportunity to standardize things and make our life better. So we're going to talk about the danger and the opportunity today, both these by different speakers. And our first keynote speaker, Dr. Lubis, will be speaking about the opportunity aspect very soon with the implant marketing for implants, greater case acceptance, and without getting the case acceptance, everything else that we are here for is meaningless. If we can't get the new patients in the door and having them say yes to our treatment, then all our exotic treatments and the treatment planning that goes behind it is meaningless. So we will start with case acceptance and marketing. But now first, let me speak about some of the dangers. There's no doubt that dental implants or implant dentistry is expensive. It's an expensive procedure. For some patients, other than buying a house and a car, this could be their most expensive investment that they make. This is $20,000 worth of treatment, 3 implants with the site preservation, the site development, and the patients are financially stretched, even for a first round of implants. They may have reached their financial limitations even to have the implants done the first time. So if you were that person or that consumer